Monica?
Yeah, hi.
Dr. Jackson, nice to meet you.
Nice to meet you. Come on in. Sit down. Sit.
So tell me what's been going on.
Okay, so first, I started feeling kind of nauseous and I started vomiting. And then I thought I was sick because I woke up one night with a fever and the chills. But then, I started having it started hurting in my my lower stomach or whatever. And I thought maybe I'm just going to start my period or I don't know what's going on. And then I had intercourse with my significant other. And it hurt more than usual, and it down there smelled kind of weird, and I was having a really weird discharge, and I don't really know what's going on.
Well, it sounds like you have pelvic inflammatory disease, also known as PID, and it's an infection of the woman's reproductive organs. It occurs when an infection spreads from the vagina to the cervix, and then from the cervix to the endocrinium, or the lining of the uterus, and then the fallopian tubes.
So how did I get it?
So this happens when bacteria travels to the reproductive system. A single bacteria or mixture of several bacteria may cause the infection. Many common bacteria that initiates PID is gonorrhea or chlamydia.
Wait, so is it curable or am I gonna die? What happens next?
So primary treatment may be antibiotics. Sometimes doctors may prescribe more than one type of antibiotics. Rest is very essential for healing, and sometimes surgery may be essential to remove the infected or damaged tissue.
So what happens to me next?
If you don't get treated, the formation of scar tissue will happen both on the outside and the inside of your fallopian tubes. That could lead to tubal blockage, ectopic pregnancy, which is pregnancy outside of the womb, infertility, which is the inability to get pregnant, and then pelvic abdominal pain. Call me if you have any questions or your symptoms just get worse.
Okay, thank you, doctor.
Thank you. Bye.
Drive safe.
If you are sexually active, seek immediate treatment for symptoms such as bleeding or unusual vaginal discharge. Limit number of sexual partners. Do regular screening, test for STDs, and use latex condoms. PID affects about 5% of women in the U.S. It's most common in sexually active women ages 15 to 24. Odds are higher if you've had sex with more than one person or your partner has had sex with other people. If you've recently had an intrauterine device to keep from getting pregnant, if you've had PID or STI before, or if you douche. Fun fact. Each year, 1 in 4 teens contract an STD or an STI. PID is also often called the silent epidemic because it's common among sexually active women but doesn't always cause symptoms.